Hi, everybody. This is Coach Mark, and just taking a quick minute to welcome each of you to our program and to thank you for your trust and support of our Institute and our mission to help educate and continue education of coaches. So before we get into any content, just a quick program note that we're going to be discussing some items that are relative to personal health, and therefore we have to consider some perspectives. So, for example, we're going to be talking about gut microbiome, and due to the delicate nature of some gut microbiome subtopics, we have to be prepared for the fact that we might be stepping into territory that our client may not feel comfortable talking about. So, while we view it from an open-minded perspective, our client just doesn't see it the same way. And we have to be pretty understanding about this when we hear some of the terminology, such as leaky gut syndrome, or even dumping disease, because while these all sound pretty bad, they can be tough for our client to talk about, in addition to the stigma that's often attached to some conditions that are directly related to our colon and the bowel. So the perspective of the client matters, and we always want to be considerate of others and use common sense when we're coaching them and bringing up personal health issues. It's also important to understand what type of client you may want to target with this type of coaching. So once we have a client in our midst, we want to, of course, assess each client, and we need to understand what our client already knows and believes about their health and their perspectives on nutrition and their body and their metabolism and even their gut microbiome. This will definitely be an indicator of your client's knowledge. Now, in some of our courses, we try to refrain from what we call providing expert information, because this is just like telling a client what to do or assuming that the client doesn't already know what they need to do. But in many cases, when we coach a client with a gastrointestinal disorder or something related to digestion, there's a great chance that this client may know more about a particular condition than you do. In this way, for this part of our triad coaching model, which is described later, the only thing that we really coach related to gut microbiome is that the coaching style is different than how we normally train coaches to share expert knowledge in a coactive relationship with your client. This is because there's going to be a gap in what your client knows about gut microbiome and the science that is still emerging and still pretty fresh. This is why we assess our clients' knowledge and fill the gaps in with some information when necessary. As you are about to learn, understanding the gut microbiome can be fairly complex, so put yourself in the shoes of your client who really knows nothing about it or very little, or worse, could have some misinformation about what's going on inside of them. Now that we have that out of the way, let's continue on with our first module. Hi everybody, and welcome to the first lesson for your Integrative Health Coaching course. This is Mark Tian. I'm the director at the Spencer Institute. I will be with you during this journey as we all learn to be integrative health coaches. Our first lesson is dedicated to gut microbiome. For both 2020 and 2021, gut microbiome testing and metabolic testing have really become more popular as people are trying to recapture their health. The convenience of these tests that are done for consumers in their home has really exploded the popularity of these products. So now think about these labs or these clinics that perform metabolic testing or gut microbiome testing for medical purposes. Now consider this type of testing and bring it into the home environment where a consumer or anyone in the general population has access to this type of testing. This is a fairly straightforward process when the tests have been ordered by a primary care physician or any sort of healthcare professional, because a test is usually ordered for a patient, and a patient will then usually go through a protocol to test for problems that drive them to seek help in the first place. So something maybe isn't right with how they feel, or they just don't feel well. So like a good coach, the success of the doctor helping this person really relies on them being able to view the person holistically. And this means looking inside the client sometimes too. Typically, medical training has not really emphasized this skill for all generations of medical professions equally. Now, even lifestyle modifications are proving their value for doctors who know that they're facing an epidemic of obesity that's simply going to get worse if current trends continue. It's not uncommon for a larger lab to process hundreds of blood tests every day, and this usually involves 12 to 14 vials of blood per person. So when we're able to look at the major metabolic pathways within the body, there's really no hiding if there's something going on internally. So ideally, the physician can isolate or find problems when looking at certain biomarkers to establish a baseline reference and then track this person's health. But to be fair, this is really similar to what the integrative health coach would do, but with one exception. Because when the integrative health coach is successful, the client actually learns some lifelong behaviors that support not just gut microbiome and metabolic health, but a higher quality of life overall. So just like any other healthcare expert, we would obviously look at the need for implementing nutrition and lifestyle strategies because we're coaches, and we look at the factors that can be better managed so we can try to reverse some of the values that are out of range and improve metabolic pathways and the optimal expression of health. Even prior to the global quarantine, gut microbiome and metabolism was an exciting area of study due to the advances in technology. Now its importance has been brought forward as we all find more time or are maybe forced to look at our health during the quarantine. So how it became to be is less important than realizing a few key points. So whether considering research opportunities through studies or the recent growth in the consumer interest, the gut is the primary focus for this area of study and recent consumer interest. So a qualified nutritionist has a place here and has really never been in more demand, and the work that we do might be seen as never more important. An important word here, though, is qualified. We need to be qualified in all areas of nutrition, but not at a clinical level. In most parts of the United States, a nutritionist has a simple definition, and this allows us to discuss nutrition with our client if we've had some training specific to nutrition. A nutritionist is also one who might have done some coaching to help clients face some behavior changes that are usually needed and tied to nutrition. So there are multiple ways that an integrative health coach could work. You might be working with a client who struggles to eat properly, and this client might need full 60-minute weekly sessions to contain behaviors representing a more urgent intervention. Or you might laser coach your way through a well-seasoned client to be more supportive or building on past goals that can now proceed as part of a bigger strategy. We'll talk about laser coaching later. So a certified integrative health coach can dramatically help a client just by helping to get their gut working better or well. And correcting major immune responses might mean that dealing with a pathogenic bacteria living within the gut of the client has to be uncovered and then addressed. A client can then rebuild their immune system and do a lot of things to improve their health. And your role as the coach is to support them, to help the client identify what their needs might be, and then to provide solutions for them. Another thing that coaches face is that a lot of people will have gut issues that they don't even realize as being a gut issue. For example, when we start looking at how leaky gut really affects the whole body, we even see plugged sinuses and maybe a scratchy throat as symptoms. But how does that actually happen from food? So as an example, if one has a dairy intolerance with foods consumed, the body will dump out antigens into our sinus tract and give you a blocked up nose. So we try to take a quick breath maybe and find that we can't breathe through our nose. And this is probably a good indicator that there's something not right inside of you, and the body will start tagging proteins that look similar within your body. And this ultimately is believed to lead to conditions like rheumatoid arthritis or even fibromyalgia. These actions also have a big effect on the adrenal glands, which manage your daytime hormone and energy production. So, as you might have guessed, it leads to fatigue over time. Of course, then there's the direct responses within the bowel and the colon itself. This includes anything from constipation, diarrhea, irritable bowel syndrome, or even Crohn's disease. All of these have a major association with inflammation within the digestive system with some really far-reaching effects. So it can affect the thyroid or conditions like Hashimoto's or Graves' disease and other autoimmune thyroid conditions commonly seen to have been reversed by fixing the gut and the food choices that are put into it. Another condition that an integrative health coach is likely to see is a client with an over or underactive thyroid, which is often paired with a gluten intolerance problem. Also true in many of these cases are these reactions that end up affecting the skin because of the actions of the liver, which gets overloaded, causing toxins to spill out through the skin. So these immunity molecules will start moving up through the skin, and you'll see things like acne or eczema, even psoriasis flare-ups, as being part of this autoimmune response. Some research is also studying the behaviors that lead to this sort of risky eating and a decidedly casual ignoring of health metrics that could be out of range. Some of this is due to the information being new or even confusing to some, but for now, it appears that literally what we eat directly affects how we think and feel, and we can prove this. When we consider the gut-brain axis as two parts, we really see the brain axis as including a three-way intersection between the brain, the gut, and then the digestive system and the microbiome, and all of that bacteria that live within our digestive system. All right, so kind of early on here, but getting into some guidance on coaching already includes the need to know a bit about the nervous system, especially when we're talking about gut microbiome. The nerves innervating it are actually from our autonomic nervous system, and it's got two branches, the parasympathetic and the sympathetic. So your relaxation response is your parasympathetic nervous system kicking in. Your stress response is your sympathetic nervous system. The vagus nerve from the parasympathetic side supplies the flow of saliva and our ability to break down these foods that we consume. It controls peristalsis and secretion of pancreatic enzymes, and it controls the release of bile to be able to break down the fats that we consume. So all of our digestive system is on one side of our nervous system, the parasympathetic, or a relaxed side. So if we're stressed while we're eating, we're not going to be able to break down the foods that we're consuming, and it can be really difficult for our client to simply relax when they're eating or eat in a relaxed environment or under relaxed circumstances. Many times these are coachable behaviors that can be changed. It can be really difficult to learn deep relaxation unless your client is able to use meditation or anything that will allow the client to get into a deeper state of relaxation. One of the best ways that we can get into this relaxation response is to simply try deep diaphragmatic breathing. We can control our breathing, and our breathing has a direct control then on our autonomic nervous system. It can be really difficult for a client to learn to go into a deep stage of relaxation unless they're willing to try things like meditation, but anything that allows them to go into a relaxation phase or a response, because it is not automatic. And most clients will need some help getting to a point where it's even second nature for them. Another tip of guidance that we want to impart here is to give your client some basic advice on chewing. So how many times do you think people chew a mouthful of food? Most people would guess around 5, and that's probably a great guess, but the actual number is just 4 times. So if someone's taking a bite of food, they will just chomp down 4 times before they swallow it. That's on average. So if we're not chewing correctly, the mixing action of added saliva will mean that the enzymes in our saliva will not get around the food as much. So it's not going to be as easily digested or broken down. We want our client to know the value of proper chewing. And chewing more ideally to a liquid form gives the client this awareness. This easy sounding goal is actually the hardest for most clients. But chewing to liquid is actually a boon for weight management. The reason being that the hormones controlling how satiated or satisfied, essentially, we are or how we feel are ghrelin and leptin, and they work on a feedback loop that's impacted by how fast and how much we eat. So chewing to liquid really helps our digestive system in a couple of different ways. So back to some science now. Now, controlling stomach acid is also important. The stomach is where our body makes and releases hydrochloric acid, which is a strong acid that gets down to a pH of about 1.5 to 2. This helps break apart the proteins that we consume into amino acids to use later. So a lot of people with stomach issues are traditionally going to have things like indigestion, heartburn, acid reflux, and the normal list of problems. And 80% of people who present with these kinds of conditions are often put on medications like proton pump inhibitors to reduce the amount of acid that they have. But when acidic conditions in the gut don't meet a certain threshold, the pyloric valve is affected. It will only open when the pH gets strong enough. If this valve doesn't open and food sits in the stomach for too long, it can churn up and send acid up into the esophagus. So we need to support stomach acid balance, but we don't always need to neutralize it as a standard approach for any problem in the gut. Unfortunately, most of us don't learn that what we eat can have effects on our health and even how we think and feel. Furthermore, most of us don't face the realities of a slowing metabolism with age. As an unmodifiable risk factor, age cannot be changed, and advancing age is also the time when health problems tend to emerge, and of all things, we're usually older and unable to use physical activity to stay healthy like we could when we were younger. So, as nutritionists who coach integrative health, we are most interested in looking at the connections between this tube that we're talking about, the gut tube that's about 20 to 30 feet long with different sections within the tube. You will learn more about digestion later in another video. Many nutrition, health, and fitness professionals have long believed that this part of the body is the key to good health, and it's based on the following. The first is that this tube is where you break down the foods into base nutrients so that we can absorb them, maintain, and rebuild our bodies. So if the system is not working very well, you're not going to be absorbing nutrients well, and if you're not absorbing nutrients well, then you're not going to be able to be building the trillions of cells that make up the body either. Ideally, we would be more aware of how things change for us over time with advancing age and take appropriate action when we're young and be effective at making change. Another reason for us to really dial into gut microbiome health is that nearly 80% of our immune system is in the gut tube. So if 80% of our immune system, which is what protects us from the outside world, is located in our digestive system, it means that these highly specialized cells designed to regulate our immune system are regulated in our digestive system. Simply put, the digestive system is the home to our immune system. Our greatest surface area of exposure to the outside world is actually not what you think if you would say it's our skin, because instead it's actually our intestinal or GI tract. If you look at our skin, the surface of the skin may be a couple of square meters, but the surface area of our digestive system, and particularly the small intestine, is 20 to 30 square meters. So it's like unpacking 2 to 3 tennis courts when it's unfolded. We will also be learning about these specialized folds within the intestines and how they act to increase the surface area of the environment. The increased surface area in this part of the body allows for maximal absorption of nutrients from the foods that we consume. So there is a lot going on in this part of the body, and it naturally has a feedback loop directly to the brain. Now, whenever we eat any food, our body and our body's immune system is looking at these foods and it's trying to determine or decide whether or not these foods are a virus or whether they are just food, particularly protein. So the body will look at these proteins and determine if this protein is a food or if it's a threat in the form of a virus. So the body has to distinguish within all of the food choices that you make what you're eating, whether it's safe to eat or if it should be attacked. In this regard, animal instincts still dominate the brain. So let's jump straight into a really common food that a lot of people like eating, which we know is causing a lot of immune responses. As we go through this discussion on immunity and food, think of other common problems that you might encounter with a client. When some populations eat foods that contain gluten, their immune system is tagging gluten as an invader, essentially mistaking it as a virus, and then they're getting some kind of immune reaction or response to that. This complex response has some really deep effects that go way beyond the gut and what we will study here. But essentially what's happening is something called intestinal inflammation or leaky gut syndrome. Now it's believed that the junctures in the intestines become loose and half-digested foods can get into the bloodstream and cause an elevated immune response. So it starts off with this sort of intestinal inflammation, which then leads to nutrient malabsorption and the resultant elevated immune response. Likewise, a lot of people have gastrointestinal issues from the added effect of multiple food enhancers, as they're known, meaning that they may well get something like diarrhea or acid reflux, but then something in their food contributes to bloating from gas production and then escalates up to an upregulation of the immune system and the development of autoimmunity issues. So this is not just an isolated or small problem. In one lab, 80 to 90% of people who presented with autoimmunity had roots in digestive system troubles or dysbiosis. With integrative health coaching, we also have more options because we're dealing with the triad coaching model, and we have 3 different points to address with our client and multiple ways to address these common problems. So we consider what our client eats from assessment of food logs, which should be ongoing, as the parts of a plan that we keep where we toss from within their intake plan, or we allow foods and encourage or promote them as part of their gut microbiome or metabolic health. We might even do an elimination diet to kickstart things. A lot of current research is focusing on a belief that when food comes into the small intestine, that nutrients are broken down, and that this is where the food intolerances are believed to occur. So a client assessment that reveals any of the following is a sign of what we call dysbiosis. This includes bloating, loose stools, diarrhea, belching or burping after meals, headaches within an hour of eating, excessive appetite or poor appetite, feeling worse or poor after eating, certain cravings, or abdominal pain or cramps. A client with 2 or more of these symptoms is a good candidate for your service. They are also showing some really solid signs that there's a need to improve their digestive system and how it performs. If your client has a known diagnosis of irritable bowel syndrome, or if they've got eczema or even acid reflux, these are also big indicators of an autoimmune disease that your client may already know about or should be encouraged to have a doctor visit regarding. Ultimately, we have to understand that we not only assess our client from their food intake and using food logs, but we also assess their understanding of the gut microbiome and their perspectives, sometimes on food as well. We spend a bit of time in the metabolism module talking about perspectives once again, but perspectives from the client always have to be considered as primary. For example, for a client with a known condition, it is likely that they know more of the problem again than we do. This is okay, and we're not really trying to be the fixer of all problems. But with respect to gut microbiome, the coach is more of an informant, filling gaps that the client shows in their knowledge versus their intakes, or their application or execution. Food logs are great, but we still need to know more about our client to bring them into a triad coaching model successfully.